much sleep could lead to heart problems, a study has found. Researchers discovered death and diseases of the heart or blood vessels in the brain are more likely to affect people who had more than 8 hours sleep a day compared to those who slept for between 6 and 8 hours. The study looked at data from 116,000 people aged between 35 and 70 in 21 different countries. When they returned at an average of 8 years later, they found 4,381 deaths and 4,365 major cardiovascular events. Participants who slept a total of 8 to 9 hours a day had a 5% greater risk of suffering such an incident than those who slept 6 to 8 hours. The danger rose to a 17% higher risk for people sleeping between 9 and 10 hours a day, while those sleeping more than 10 hours a day had a 41% increased risk of cardiovascular disease or death. Co-author Professor Salim Youssef, from McMaster University, Ontario, Canada, said, "The general public should ensure that they get about 6 to 8 hours of sleep a day. On the other hand, if you sleep too much regularly, say more than 9 hours a day, then you may want to visit a doctor to check your overall health." For doctors, including questions about the duration of sleep and daytime naps in the clinical histories of your patients may be helpful in identifying people at high risk of heart and blood vessel problems or death. The team also found a 9% increased risk for people who slept a total of 6 or fewer hours, but this finding was not statistically significant.